Thank you, Madam Deputy Speaker. And it is a pleasure to bring this adjournment debate to the Chamber on a topic that is close to my heart, and I refer members to my register of interests as the chair of the APPG on infant feeding. And I am pleased, as always, to see the Minister in her place, and I look forward to her response on behalf of this government just days before the long-awaited 10-year plan for the NHS. When the Secretary of State for Health promised to create the healthiest generation ever, it was a bold and admirable ambition, and certainly one that I share with him. Every child deserves the opportunity to thrive, regardless of their wealth or their postcode. When this government talks of building a better future for children, their policies and schemes often start with school, with free school meals and breakfast clubs, or providing government support for nurseries and early years settings. But there is very little substance in the critical years from birth to 3, and even less when it comes to policy around infant feeding, whether that is breastfeeding, formula feeding, or a combination of the two. Now, I had my son nearly 11 years ago, and I remember with fondness the lactation consultant coming onto the ward in the maternity unit and showing me how best to hold my son to feed him and what to expect in the first few weeks after taking him home. And I did not have an easy journey with breastfeeding, suffering with pain when he latched. I had multiple bouts of mastitis, swelling, and the list went on. My husband and I ran our own restaurant at the time, so he took approximately 3 hours of paternity leave before returning to work. I'll happily give way to my honourable friend.
Thank you. I thank my honourable friend, and I'm grateful to her for the work that we're doing together on the APPG for infant feeding and all her passion in this space. Madam Deputy Speaker, breastfeeding is a full-time job. Only last week, Carrie Johnson, the wife of one of our former Prime Ministers, highlighted how easy it is to neglect your own needs as a mother while breastfeeding. Does my honourable friend agree with me that it's essential that this government establish 6 weeks of paid paternity leave so that breastfeeding mothers can focus on feeding their baby and partners can focus on looking after mum?
Yeah.
I thank my honourable friend for her intervention, and I was so pleased to see the statement in the House earlier today, and I know that she's been a tireless advocate for making sure that parental leave for all parents is improved dramatically, and I thank her for her advocacy in that area. Happily give way to my honourable friend.
Madam Deputy Speaker, first of all, can I commend the Honourable Lady for Chichester? I spoke to her beforehand. In the last term of Parliament, one of the Scots Nats MP was chair of this organisation, this APPG. I was supportive of that as a man. I thought it was important, and my wife was an example of where breastfeeding is so important. But is the Honourable Lady aware that Northern Ireland scored the highest 69.5 out of 100 between UK nation comparisons? And this may be because Northern Ireland has already put policies in place and is the only nation to have completed updated resources on infant feeding and HIV, giving Northern Ireland the top score. So would the Honourable Lady not urge with me the Northern Ireland Health Trust to share best practice with the other devolved nations, with the Minister here, to help encouragement of breastfeeding for those mothers who are able to do so?
I thank my honourable friend for his intervention, and he's absolutely right that Northern Ireland scored the highest on the report card format on the World Breastfeeding Trends Initiative, which I will come on to. England scored a paltry less than 50 in comparison to Northern Ireland's score, and that was very much due to the fact that England scored 0 when it comes to infant feeding and HIV. Happily give way on that point.
Thank you, and thank you to the honourable member for bringing this adjournment debate on such an important topic. She spoke of some of the difficulties that she had at the start of her breastfeeding journey, which is something that my partner Catherine also experienced. And when having those difficulties, she accessed a breastfeeding support clinic in my constituency at Meadway Health Centre, which was a huge source of support and benefit to her as she navigated that journey. Does the honourable member agree with me that protecting access to those kind of services and ensuring they're there for every woman who wishes to breastfeed is extremely important and something we should support?
Jess.
I thank the honourable member for his intervention, and it's as if he's lifted my words directly off the page in a very timely manner, because the reason that I managed to carry on was because I attended a peer support group in my local church hall every Monday morning, aptly called Milk. And actually, it wasn't about the professional support that I got while I was there, although that was great, and shout out to the wonderful Julie, who supported all of the mums there. It was actually the other mums who were going through the same things, who could ask each other questions, offer advice, as well as the amazing trained peer supporters, the volunteers, and a quick shout out to Holly, who showed us that we could and would survive those difficult first few months and come out the other side just like she had. Happy to give way.
Thank the honourable member for securing this really important adjournment debate this evening. In South Derbyshire, I hear stories of services being cut to support breastfeeding women. As a mum who breastfed to 8 months, but I had that moment where I almost didn't, and it was my community midwife that saved the day for me. I wonder if the honourable member agrees that, as well as having services to support breastfeeding women, whether they're successful in doing it or decide not to do it or can't do it, that actually we should be creating safe spaces for them for that, which is exactly what I've done in my constituency surgery. But I would like to see that in other venues, and I wonder whether she would agree with me on that.
I thank the honourable member for her intervention and for sharing her personal story, and also for advocating for other breastfeeding and formula feeding parents in her constituency. And she highlights that there is a postcode lottery when it comes to that support, and so we need to see across the board those safe spaces for all parents that are feeding. And in the group that I attended, it wasn't just breastfeeding mums, it was mums who were combination feeding or in the process of introducing solids or planning their feeding journey as they navigated returning to work. Some of those women became my closest friends, and I still have them in my life all these years later.
Will she give way on that point?
Happily give way on that point.
Thank you. And I thank the honourable member for bringing this important issue to the chamber. My wife and I are expecting our first in the coming weeks. So as you can expect, this is an important subject that I'm quickly upskilling on. So in my constituency, I have a very similar group, so Exmouth Bosom Buddies, who are doing a really fantastic job, which we know that relieves pressure on the NHS. So what more do you think can be done to allow these groups to really grow, thrive and flourish so they can continue doing their vital work?
Before the honourable member gets to her feet, I'm just reminded of the Crowborough Birthing Unit in my constituency, midwifery-led, helping lovely mums in my constituency. Jess Brown-Fuller.
I thank the honourable member for his intervention, and he highlights how important having that community-based support in an area is, but unfortunately not every mother across the UK can say the same for that. There are areas where they have to travel up to an hour by car to attend that sort of group, and I will come on to that. Because when I had my daughter, 5 years after my son, the support that I had relied on had all but vanished. Milk that I had relied on was now being run out of, in effect, a broom cupboard in my local leisure centre, with no opportunity to socialise with other mums. It was only 6 months later that the pandemic hit, and my daughter's health visitor reviews were done via Zoom, often without my daughter even on the screen. The local children and family centre in my constituency never reopened in the same way after the pandemic. Now, I was one of the lucky ones, because I'd already built my village around me 5 years earlier. I had a network of friends and family that I could call on. But for those new mothers in the last decade, that support has been all but vaporised, with community support groups being patchy, often delivered by volunteers or those wonderful midwives in their time off. And it's also essential, Madam Deputy Speaker, to acknowledge and support those parents who cannot or choose not to breastfeed, ensuring that they feel empowered and confident in the decisions they make for their children's nutrition and well-being. So I'm a proud advocate of every parent having choice, but that choice should be an informed one, and currently it's not a level playing field, with formula companies preying on the vulnerability of parents. The Competition and Markets Authority launched a market study into the formula industry in February 2024, and they published their results earlier this year. Now, this provided a comprehensive, in-depth and up-to-date exploration of the infant formula market in the UK through a consultative process that has offered really unique insights into the industry. And I'd just like to read a short extract from the CMA's executive summary on their findings. Parents are often in vulnerable circumstances when they first make choices about whether and which infant formula to use. Their brand choice is often based on incomplete or unclear information, and they are typically then reluctant to switch brands. Against this backdrop, manufacturers place significant emphasis on building their brands, including through their willingness to supply the NHS below cost, and differentiating their products to attract parents rather than competing strongly on price. And price competition between retailers has typically been weak. Our analysis indicates that these features in combination are leading to poor outcomes for parents in terms of the choices they make and prices they pay for infant formula. In short, Madam Deputy Speaker, a vulnerable, extremely tired new parent is making choices on which formula to buy, but often the claims on boxes of commercial infant formula are unfounded, and they're causing parents to choose between a £7 tin of formula or a £14 tin of formula, even though they are nutritionally equivalent. At a recent event, we heard testimonies of parents who had purchased the more expensive brand with bold claims on its packaging, believing that they were doing the best for their child, only to then use less scoops when making a bottle to make the tin last longer. And you only have to look at our supermarket shelves to see formula milk locked behind glass cabinets to show that we have a crisis in families being able to feed their babies. The cost of living challenges have spiralled into a food insecurity crisis, yet formula manufacturers increased prices by 24% in 1 year in 2023, and they continue to rise well beyond inflation. And research shows that parents rarely switch brands once they've introduced a formula milk. This gives formula companies a clear incentive to offer their products to maternity wards at reduced prices, knowing parents are likely to continue using the same brand when they go home. So to address this, the CMA recommends standardised infant formula labelling in healthcare settings, which would eliminate this form of exploitative marketing. Formula companies are also restricted from advertising newborn formula, but they get round this by advertising their follow-on or stage 2 milk and then making the packaging look exactly the same. The CMA recommendations ask for the government to assess whether infant formula and follow-on milks are clearly distinct and then communicate that assessment to the manufacturers and enforcers. A Mintel report from 2016 reported that in 2015, for every baby born in the UK, companies spent a staggering £21 just on marketing follow-on formula. So the CMA has made 11 recommendations to government, all of which aim to improve outcomes for parents. I'm calling on the government today to implement all of the 11 recommendations and finally level the playing field for those parents that rely on formula to feed their babies. Now, Madam Deputy Speaker, this debate is very timely, as last week I was delighted to host the World Breastfeeding Trends Initiative launch of their 2024 report here in Parliament. I would be delighted to give the Minister a copy if she doesn't already have one. The key takeaway from the report is that the UK has one of the lowest breastfeeding rates in the world. The report not only highlights the gaps in policy, but it also creates a report card system for each of the 4 nations. And I just want to highlight a few things that were mentioned within that report. Importantly, data, though its collection is uneven across the 4 nations, shows that the majority of mothers do set out to breastfeed. Despite this, by 6 to 8 weeks, around 70% of babies in the UK receive some formula, and by 6 months, only 1% of babies are exclusively breastfed.
Will my honourable friend give way?
Happily give way.
I'd like to commend her for the great work she's doing to improve the relationship, the most important relationship in the world between a mother and her infant. Will she join me in paying tribute to the Midwives of Paris Teaching Health Board, who have the largest county in Wales to cover? And we should also join me in paying tribute to Susan Grounds, who after being a midwife for over 20 years, retired in March and was elected as a Lib Dem councillor in April.
I thank the honourable friend for his intervention, and he's absolutely right that quite often these women have been so embedded in their communities for so many years, helping these women raise their babies, that they go on to do marvellous things in the community. And the majority of those who stopped breastfeeding early wanted to breastfeed for longer, but didn't receive the help they needed to resolve problems, all of which could be addressed with support from trained health workers, skilled peer supporters, or specialist help in hospital, at home, or in the community. The World Breastfeeding Trend Initiative report highlighted the absence of national policy and governance in England. Now, the devolved nations have pulled ahead on this front, with Scotland publishing a strategic framework, Wales having had an action plan since 2019, and Northern Ireland currently finalising their very own strategy. Support needs to be baked into policy and legislation because communities cannot do this alone. The government has all the opportunity to act by being so early into the parliamentary term. I was delighted to see the announcement today into a review of the parental leave and pay system, and I hope infant feeding will play into the considerations of better support for parents on maternity and paternity leave. Health visitor teams have also dwindled over recent years, and an estimated 54,000 GP appointments could be saved every year if there was a professional feeding service available in every community. And any strategy must be properly funded and integrated with current programmes across communities and healthcare settings such as family hubs and Start for Life, which should themselves be expanded. Particularly Start for Life, which is currently only funded in half of England's local authorities. Some councils are choosing to make this an area they improve on, and I'm pleased to see my local authority, West Sussex County Council, including the early years as part of their health strategy for the next 5 years, even without the Start for Life funding, which they currently do not receive. I'd like to just very quickly use an example of a mother that got in touch just last week to share her story. She had a traumatic birth with unexpected interventions. Her baby was fed formula by hospital staff very quickly. The pump kit didn't work in hospital, and there was no available or meaningful help. She really wants to feed her baby herself. She looked online when she got home to find help nearby, but there was nothing less than an hour away by car. She is struggling with which formula to use and doesn't really understand what is the difference between them. She doesn't know other women with babies. She's feeling very lost and isolated. Social media is full of conflicting advice, so she has reached out of area for paid support she really cannot afford on maternity pay to help her try and regain a sense of reality. I'm sure this lady's reality is the same for parents across the country. And if the reasons I've highlighted in this debate are not compelling enough, then maybe the economic impact is. UK research on the costs of 4 diseases back in 2012 showed that even reaching moderate breastfeeding levels could save the NHS millions, and that the implementation of proven breastfeeding support systems would pay for itself within a year. For babies, breastfeeding strengthens the immune system and significantly reduces the risk of infections, obesity, asthma, and long-term conditions such as type 2 diabetes. And for the mother, breastfeeding lowers the risk of breast and ovarian cancers, cardiovascular disease, and supports postnatal mental health. There is so much more I could say, Madam Deputy Speaker, but instead I will move to my asks of this government. When will the government make its decision on whether they will accept the 11 recommendations from the Competition and Markets Authority? Will the Minister consider following the devolved nations and introduce a comprehensive national infant feeding strategy to end the postcode lottery and provide support to all parents in their feeding journeys? Will we expect to see something about infant feeding in the upcoming NHS 10-year plan? And finally, there is very little about breastfeeding in most health professional training, but primary care has successfully integrated assisted roles into primary care services such as pharmacists and social prescribers. Could the same model be extended to lactation consultants? I'd like to finish by saying thank you to all of those tireless activists and campaigners who have been fighting for all women to have support, guidance and trusted information when they begin motherhood. I won't risk trying to name them all, as I will no doubt miss some. But a special thank you to the World Breastfeeding Trends Initiative Steering Group, to First Steps Nutrition Trust, and also to the previous Honourable Member for Glasgow Central, who chaired the APPG before the general election. Thank you.
I call the Minister Ashley Dalton.
Thank you, Madam Deputy Speaker, and I'd like to congratulate the Honourable Member for securing this debate. Through her leadership of the All-Party Parliamentary Group on Infant Feeding, she is working to ensure families across the country get the right support. And I'd like to thank all members that have contributed today, the member for Ribble Valley, Strangford, contributions from the member for Altrincham Sale, South Derbyshire, Exmouth and Exeter East, Brecon, Radwa and Cumtawi. And, of course, from yourself, Madam Deputy Speaker. Thank you. Thank you. I think the number of interventions and contributions in this debate today has just shown how important this issue is and how deeply felt it is across the House. The Honourable Member asked about the 10-year plan. I will not be going into details of what the 10-year plan has got in it, but TikTok, she does not have to wait very long, as this will be launched on Thursday morning. And I look forward to taking forward and working with colleagues from across the House and the wider health landscape on how we deliver in the plan. But within that plan, you will see that children's early years are crucial to the development and their health and their life chances, and that is reflected in the government's mission. It's why the government's taking a mission-based approach to raising the healthiest generation of children ever, and to ensuring that every child has a healthy, happy start to life. I will.
I thank the Minister for giving way. Just to reiterate my honourable friend's comments and the comments made just now at the dispatch box about all children need to have a healthy start. we can't emphasise how important gestation and the first 6 months of life is. The factors that affect gestation and the first 6 months of life have a bigger impact on long-term health than anything you can do after that period of time. Any conscious decisions you make about your own health are less impactful than what's happened to you during gestation and the first 6 months of life.
Minister.
I thank the Honourable Member for his intervention and agree, and he will see as the 10-year plan comes forward, and also looking at some of the investments that we are making around, for instance, reducing the numbers of women smoking in pregnancy, etc. That is something that the government recognises. And we recognise that infant feeding is critical to a baby's healthy growth and development, and recognise the significant benefits of breastfeeding for both mothers and babies, and are fully committed to supporting families to breastfeed should they choose to do so. We know that most mothers want to breastfeed, but many stop before they would ideally like to. Whilst it's been positive to see many more mothers continuing to breastfeed in recent years, we know that they can face complex barriers to achieving their infant feeding goals. And I recognise the concerns raised through the World Breastfeeding Trend Initiative report on the UK infant feeding policy landscape. Whilst health is devolved, and I would like to recognise the performance in Northern Ireland that was raised by the Honourable Member for Strangford, and commend them on that. But we know through this report that England in particular in the UK scores poorly, and that is something that we want to change, Madam Deputy Speaker. And families need quality services, trustworthy information, affordable options and systems that support, not hinder them. Midwives and maternity services play a crucial role through the perinatal period in preparing and supporting families around infant feeding. We've committed to training thousands more midwives to better support women throughout their pregnancy and beyond. And there has been an increase of over 1,300 full-time equivalent midwives in the workforce since April 2024. We will publish a refreshed workforce plan to deliver the transformed health service that we build over the next decade. And to drive forward improvement on maternity and neonatal services, we announced the launch of a national independent investigation into maternity and neonatal care. The investigation will recommend one set of national actions by December. A national maternity and neonatal task force, chaired by the Secretary of State, will then bring forward independent experts to co-produce a national plan to drive forward. As families transition from maternity services to the community, it's important that they continue to receive the support they need, and health visitors are key to this. But we know health visitor numbers have decreased, and whilst there is variation in level of services across the country, it remains a universal service, and we are committed to that. In the plan to change, we commit to strengthening health visiting services so all families can access their support. We're building on Family Hubs and Start for Life programme, and investing in this programme with £18.5 million this year to improve infant feeding support across 75 local authorities in England. Start for Life services are helping parents to access support where they need it and in a location that suits them, whether that's their home, their family hub, in a hospital setting, or through some of the many voluntary sector organisations that have been referred to today. And local authorities are working with partners to embed local infant feeding strategies, joining up services for seamless support and tailoring them to their community with both universal and targeted support. We're building up the workforce, investing in infant feeding specialists and delivering high-quality training and expanding networks of peer supporters. Funding is also helping to train staff to identify complex needs early, such as tongue tie, and to offer timely support. And while long-term evaluation is needed to understand the full impact of the programme, some promising findings are emerging. For example, Coventry suggests that their ambitious multi-layered integrated infant feeding plans have led to increased breastfeeding rates. And local health visitor data shows an increase in breastfeeding at 6 to 8 weeks from 51% to 57% in just 18 months. And we're also helping families across the UK to access breastfeeding support 24 hours a day through the National Breastfeeding Helpline.
thank the Minister for giving way, and she highlights some brilliant examples that are gold standard in care, but does she recognise that the process that the government is currently undertaking, with only half local authorities being funded, means that we still end up with a patchwork level of cover for support for new mothers, and they don't know where they're meant to go because it's different when they cross a county border?
I thank her for her intervention. Through the Family Hub service and the support for Start for Life, that is very much targeted. However, through the Universal Health Visiting Offer, through the National Breastfeeding Helpline, we do aim to be able to offer all women breastfeeding the support that they need to do so. In terms of parental leave, which has been touched upon, we know that supporting parents goes beyond services. Returning to work can influence how families choose to feed their babies. And in the plan to make work pay, we've committed to a review of the parental leave system, which, as the Honourable Member mentioned, was launched. The DBT, the Department for Business and Trade, launched that review into parental leave in the Chamber today, and we're delighted to see that come forward. She did touch upon formula feeding, and I've spoken a lot about breastfeeding, but we absolutely recognise that families cannot, or choose, when they can't or they choose not to breastfeed, it's vital they get formula that's safe, nutritionally complete and affordable. Infant formula regulations and CMA recommendations are important, but we know many families are struggling to afford infant formula. We welcome that report from the CMA into the UK infant and follow-on formula milk. It's highlighted some of the issues that the Honourable Member raised herself, particularly noting that families rely on brand reputation and price as a proxy for quality, often choosing more expensive products. However, specific regulations require all infant formula to comply with robust nutritional compositional standards. So all infant formula sold on the UK market meets the nutritional needs of babies, regardless of the price and brand. The CMA has made 11 recommendations to government, and with 4 aims: to eliminate brand influence in healthcare settings, providing better information for parents in retail settings, strengthening labelling and advertising rules, and ensuring effective enforcement of regulations. The government is supportive of what the CMA is trying to achieve, and we want parents to be confident to choose lower priced products and for manufacturers and retailers to compete more on price. The CMA recommendations are UK-wide, and so we're considering them alongside colleagues in the devolved governments and aim to have a UK-wide response available as soon as possible. In conclusion, Madam Deputy Speaker, I thank the Honourable Member for raising this important matter. The Government is committed to giving children the best start in life. We do not underestimate the challenge to get this right for families. We will continue to strengthen key services built on good practice and identify where we can the greatest impact for families. I can also confirm that tomorrow I will be meeting myself with the APPG for babies, and I look forward to discussing these issues further with them.
The question is that this House do now adjourn. As many as that opinion say aye?
Aye.
The ayes have it. The ayes have it.